you're joining us from. And thank you very much for being with us on this Thursday morning, where we bring you the briefing of the Africa Centers for Disease Control and Prevention. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission. And as usual, we have Dr. Ahmed Ogwell with us. He's the Deputy Director of the Africa CDC, and he will be talking to us about the different public health issues, including COVID-19, that we are dealing with on the continent at the moment. Now, the WhatsApp number for you to use when we come to that question and answer section is +251 94 550 2310. You can also join us live or send in your questions through the question and answer section. Right now, let me welcome and bring on board Dr. Ahmed Ogwell. And as I mentioned, he's the Deputy Director of the Africa Centers for Disease Control and Prevention for his briefing before we go into the Q&A. Dr. Ahmed, good morning, and you have the floor.
Thank you. Thank you very much, Wayne. Good morning, good afternoon, good evening, wherever you're joining us from. Welcome to today's briefing. And let me start by giving a broad overview of where we are on the continent in as far as public health events are concerned. As of today on the continent, we are dealing with at least 20 different outbreaks at the same time. Some are small, others medium, some are large. And we are working on all of them at the same time based on the needs of the countries where these particular public health events are. Today, we will talk about only 5 of them. And COVID, Ebola, monkeypox, yellow fever, and cholera are the ones that we'll speak about today. And let me start by giving you a quick overview of what's happening on the continent as far as COVID is concerned. To date, we've documented just over 12 million cases. And this is about 2% of the global number of cases. And out of these, 95% on the continent of Africa have fully recovered, and this is about 11.4 million people. Unfortunately, we've lost 255,996 people, giving us a case fatality rate of 2.1%, which accounts for 4.1% of the deaths globally. This is essentially to mean that we have lost 2 out of every 100 people that have contracted COVID, which is a very high number considering the tools at our disposal. When we look at the trends over the last 1 week, the week we are focusing on is epidemiological week 43, and this is the dates 24th to 30th of October. And when we compare it with the Epi week 42, we see that we have documented a total of 5,931 new cases. And this represents a 23% increase when you compare the 2 weeks, Epi week 43 and 42. 23% increase during this Epi week 43. The highest proportion of the new cases come from Southern Africa, the region of Southern Africa, which accounts for about 50% of the new cases. Eastern Africa region, 33%, Northern Africa, 7%, Western, 5%, and the Central region with 4%. It's also worthwhile to note that when you look at the individual countries, South Africa represents the highest number of cases over the last 1 week, with 2,785 cases being documented there during Epi week 43. During this same week, a total of 60 new deaths were reported, which is over 100% increase. But I must say that the large number when you look at it week by week, is because some countries report a little later, and therefore they may report every 2 weeks or so. That's why you see a jump like that. But to accommodate that late reporting, we look at the 4-week trend. And when we do that, we see that there has been an overall 4% average increase in the number of new cases on the continent when you compare the last 4 weeks and the previous 4 weeks. And the increases we are seeing in Eastern Africa, 34% increase, Southern Africa, 12% increase, Central Africa region, 2% increase, while in Western Africa, we've seen a 16% decrease, and Northern Africa also a 3% decrease. So when you look at the trends over the 4-week period, it is a little bit more stable, accommodating the late reporting. Again, over the 4-week period, when we look at the number of new deaths, we see a 55% average increase in the number of new deaths. And the increases we are seeing include Northern Africa, Southern Africa, and Western Africa, while Eastern and Central African regions, there was no change. Important here is that we are seeing an increase in the number of new deaths when we look at the 4-week trend. Let's look at vaccination for COVID-19. To date, we have received on the continent of Africa 1.03 billion doses of COVID-19 vaccines. This has resulted in administration of about 768.4 million doses, which corresponds to 74.5% of the total number of supplies that we have received here on the continent. The coverage of fully vaccinated in the total population has now increased to 25.2% of those who are fully vaccinated. And when we look at the last, at AP week 43, we note that there was over 84,000 new vaccinations that were done during that week across the continent. Coverage of boosters is at 2.9% now, and we are seeing a steady increase across the continent of vaccinations for COVID-19 as we chase our target of 70% of the population being fully vaccinated. We are seeing countries that are increasing the vaccination